Ano ang nakita ni Senador Manny Pacquiao nang pumasok siyang naka-disguise sa isang public hospital? Senador Manny Pacquiao pumasok ng DISFARÇADO sa isang pampublikong ospital. Ang natuklasan niya ay nagulat sa buong Pilipinas. Ang nangyari pagkatapos ay hindi mo inaasahan. Hindi ito simpleng inspeksyon, hindi ito para sa publicity. Ito ay tungkol sa isang bagay na mas malalim pa, mas personal pa, mas nakakapag-transform ng sistema. Manatili ka rito dahil ang kwentong ito ay magpapakita sa iyo kung paano ang first-hand experience ay mas powerful kaysa sa lahat ng reports. Kung paano ang disguise ay nag-reveal ng ugly truth. At kung paano ang isang senador na nag-disguise ay naging catalyst ng healthcare reform. Handa ka na ba sa kwentong ito na puno ng revelations at radical transformation? Philippine General Hospital, Manila, taong 2024, ang pinakakilalang public hospital sa bansa. Ang PGH ay supposed to be flagship, model, benchmark, pero ang reality behind the prestige ay complicated, problematic, concerning. Si Senador Manny Pacquiao ay may committee assignment, healthcare. Ang responsibility niya ay oversight, policy making, budget allocation. Ang role ay technical, paper-based usually, reports, presentations, hearings. Ang exposure sa actual ground conditions ay filtered, sanitized, presented through official lenses. Pero si Manny ay hindi comfortable sa arm's length approach. Ang background niya ay grassroots, hands-on, experiential. Ang preference niya ay makita mismo, ma-experience, ma-validate personally, hindi lang through intermediaries. Nag-receive siya ng multiple complaints from constituents, from advocacy groups, from whistleblowers within DOH. Ang issues ay consistent. Long wait times, lack of beds, shortage ng gamot, poor facilities, alleged corruption, overworked staff, suffering patients. Ang official responses from hospital administration ay defensive, denial. Ang excuses ay budget constraints, high patient volume, structural limitations. Ang tone ay, we're doing our best given resources. Pero ang complainants ay insistent. Ang conditions ay unacceptable, inhumane, deserving ng urgent intervention. Si Manny ay torn. Sino ang paniniwalaan? Official reports na rosy pero possibly sanitized o complaints na critical pero possibly exaggerated? Ang solution niya ay neither, kundi validate personally. Pero ang challenge ay how. Official visits ay announced, prepared, staged. Ang reality ay hidden, masked, presentable version lang ang ipapakita. Kaya nag-decide si Manny ng radical approach. Undercover inspection, disguised visit, walang announcement, walang preparation, walang sanitization, pure reality check. Ang risk ay high kung ma-expose ay scandal, pero ang potential benefit ay worth it. Truth, unfiltered, actionable. Nagplan siya carefully. Ang team niya ay minimal, isang trusted aid lang, walang security detail na obvious, walang media, walang documentation initially, pure observation mission. Ang disguise niya ay simple pero effective. Ordinary clothes, faded t-shirt, worn-out jeans, rubber slippers, cap, sunglasses, face mask. Combination ng pandemic protocols at deliberate concealment. Ang goal ay mag-blend, maging invisible. Ordinary patient companion lang. Ang plan ay pumasok as bantay, companion ng fictional patient. Ang aid niya ay mag-act as patient, fake symptoms, ER visit. Ang senaryo ay plausible, common, hindi mag-stand out. Isang Lunes, early morning, ang timing ay deliberate. Mondays ay peak, most crowded, most stressed, most realistic snapshot ng typical operations. Nag-arrive sila ng 6 a.m. Ang ER ay already packed. Bodies everywhere sa may waiting area, hallways, overflow sa labas. Ang sight ay shocking even from entrance. Worse than expected. Pumasok sila. Ang smell ay nag-hit agad. Combination ng antiseptic, body odor, blood, urine, overwhelming, nauseating. Ang ventilation ay poor. Walang air circulation, stuffy, hot, kahit umaga pa lang. Nag-register sila. Ang process ay chaotic. Walang clear system. Ang forms ay madami, redundant. Ang staff ay harassed, snappy, impatient. Understandable given volume. Pero ang patient experience ay terrible, dehumanizing. Nag-wait sila. Ang waiting area ay standing room only. Walang available seats. Ang patients ay nasa sahig, nakaupo, nakahiga. Ang conditions ay third world. Worse, ang dignity ay zero. Ang observation ni Manny ay systematic, mental notes. Ang companion niya ay may hidden camera, small, discreet, recording everything, evidence, documentation, future reference. Ang wait time ay nag-extend, 1 hour, 2 hours, 3 hours. Walang update, walang communication. Ang frustration ng patients ay mounting. Ang complaints ay verbal, loud, pero walang response from staff. Ang overwhelm ay obvious. During wait, nag-i-interact si Manny sa ibang patients, nag-blend siya, friendly, empathetic. Ang stories na narinig niya ay heartbreaking. May matanda, stroke patient. 2 araw nang nag-aantay ng bed sa ICU, nasa stretcher pa rin sa hallway, walang proper care, minimal monitoring. Ang family ay desperate. Nag-plead sa lahat, pero walang available bed. Ang response ay, maghintay lang kayo. Pero ang patient ay deteriorating, critical, nag-struggle. May bata, severe pneumonia. Kailangan ng immediate admission, pero walang bed din. Ang nanay ay umiiyak, nagmakaawa. Ang bata ay hirap huminga, obviously suffering. Pero ang systemic bottleneck ay unforgiving. Walang exception kahit emergency. May lalaki, industrial accident, shrapnel wounds. Kailangan ng surgery pero walang available OR. Ang schedule ay full for days. Ang temporary treatment ay minimal. Ang pain ay managed poorly. Insufficient pain meds. Ang suffering ay visible, audible. Ang moans ay heartbreaking. Ang pattern ay consistent. Insufficient capacity, overflowing demand, systemic failure. Ang staff ay hindi villains, victims din. Overworked, underpaid, under-resourced. Nag-try nila ng best, pero ang system ay broken, unsustainable, inhumane. Nag-observe din si Manny ng equipment, outdated, malfunctioning. Ang X-ray machine ay luma, palaging breakdown. Ang CT scan ay 1 unit lang for entire hospital. Ang queue ay endless. Emergency cases ay nag-compete with scheduled ones. Ang priorities ay blurred. Ang impact ay delayed diagnosis, wrong treatments, deaths na preventable. Ang pharmacy ay another nightmare. Walang stock ng basic meds. Ang patients ay directed to buy outside. Pero ang prescribed meds ay expensive, branded. Walang generic alternative offered. Ang suspicion ay kickback system. Ang evidence ay circumstantial pero probable. Dumating ang turn nila eventually. After 4 hours, ang patient ay examined, cursory, rushed. Ang doctor ay exhausted, obviously overworked. Ang consultation ay 3 minutes lang. Walang thorough assessment, walang proper explanation, just prescription, discharge, next patient. Ang experience ay eye-opening. Ang gap between official reports and ground reality ay canyon-sized. Ang suffering na witness personally ay worse than worst-case scenarios sa complaints. Pero ang inspection ay hindi natapos sa ER. Nag-explore si Manny ng ibang areas, wards, hallways, cafeteria, comfort rooms. Bawat area ay may revelation. Ang wards ay overcrowded, double capacity, triple. Ang beds ay sardinas, walang privacy. Ang infections ay cross-contaminating, obviously. Ang sanitation ay poor. Ang bed linens ay questionable, stained, reused without proper sterilization probably. Ang comfort rooms ay disaster, walang tubig, walang sabon. Ang toilets ay clogged, madudumi-duming. Ang smell ay unbearable. Ang patients na kailangan gumamit ay nag-suffer double. Sakit plus indignity. Ang cafeteria ay nag-serve ng food na questionable quality, cheap, unhealthy, walang nutritional value, pero walang choice ang patients. Ang prices ay hindi affordable pa rin for many. Ang irony ay sa hospital mismo, ang food ay nag-contribute sa poor health. Nag-discover din si Manny ng systemic corruption, ang fixers sa loob, offering express service for fee. Ang mga tao na supposedly helping patients ay actually exploiting vulnerability. Ang racket ay organized, tolerated, part ng ecosystem na. Ang unauthorized charges. Ang patients ay binibilhan ng supplies na supposedly provided ng hospital, but later na-discover na actually available pala, na charge lang. Ang extra income ng some staff, illegal, immoral, pero prevalent. Lumabas si Manny pagkatapos ng 6 na oras, exhausted, depressed, angry, pero more than anything determined. Ang mission niya ay successful. Ang evidence ay documented, video, photos, audio recordings, personal observations, comprehensive, damning. Nag-debrief ang team immediately, secured location, reviewed materials, validated observations. Ang conclusions ay unanimous. Ang conditions ay unacceptable. Systemic reform needed. Urgent, comprehensive, radical. Pero ang approach ay strategic dapat, hindi just expose. Kasi ang shaming lang ay counterproductive. Ang goal ay solutions, improvements, sustainable change. Nag-prepare si Manny ng two-pronged strategy. Una, immediate relief. Address ang most urgent issues agad: beds, medicines, equipment, staff augmentation, emergency interventions. Pangalawa, systemic reform, policy changes, budget reallocation, accountability mechanisms, long-term transformation. Nag-call ng press conference, major. Ang media turnout ay high, ang topic ay intriguing. Urgent healthcare revelations. Walang details initially, just teaser, building anticipation. Sa actual conference, nagpresent si Manny ng findings, showed edited video, testimonials from patients encountered, data from observation. Ang presentation ay powerful, emotional, factual, irrefutable. Ang revelation na personally niya na experience as disguised visitor ay nag-add ng authenticity, credibility, hindi hearsay, hindi second-hand, first-hand, personal, verified. Ang public reaction ay explosive, outrage, shame, demand for action. Ang social media ay nag-trend. PGH crisis, millions of posts, shares, comments. Ang pressure on government ay immense, immediate. Ang DOH leadership ay defensive initially, damage control mode. Pero ang evidence ay overwhelming, undeniable. Ang shift from defense to acknowledgement ay forced, necessary. Nag-commit sila ng immediate actions, budget augmentation, emergency procurement ng beds and equipment, staff hiring, facility upgrades. Ang timeline ay aggressive, weeks, hindi months. Pero si Manny ay hindi satisfied with promises lang. Nag-demand ng accountability, investigation sa corruption allegations, administrative cases sa involved staff, criminal charges kung applicable. Ang justice component ay non-negotiable. Nag-mobilize din siya ng legislative actions, filed bills, universal healthcare strengthening, public hospital modernization, healthcare worker benefits improvement. Ang agenda ay comprehensive, ambitious, pero ang momentum ay with him. Ang public support ay solid. Pero ang most touching outcome ay immediate ground-level changes. Within weeks, nag-improve ang PGH conditions. Noticeable, measurable. Ang additional beds ay nag-arrive, deployed. Ang backlog ay nabawasan. Ang wait times ay nag-shorten. Ang medicine stocks ay replenished. Walang out-of-stock ng basics. Ang pharmacy ay nag-offer ng generic alternatives, prominently, transparently. Ang cost sa patients ay bumaba. Ang staffing ay augmented, additional nurses, doctors, support staff. Ang workload per individual ay nag-ease. Ang service quality ay improved. Ang patient satisfaction ay nag-increase. Ang facilities ay nag-undergo repairs. Ang comfort rooms ay nag-renovate, functional na, clean, decent, ang wards ay nag-reorganize, less crowded, better ventilation, improved sanitation. Ang corruption ay nag-reduce significantly. Hindi eliminated totally, pero deterred. Ang visibility ng reforms ay nag-create ng atmosphere na someone is watching. Ang accountability ay heightened. Ang patients ay nag-notice, grateful. Ang testimonials ay pouring in. Social media, traditional media, direct messages kay Manny. Ang thanks ay overwhelming, heartfelt. Pero si Manny ay hindi nag-rest on laurels. Nag-expand ang undercover inspections. Sa ibang public hospitals, different regions, same methodology, disguised visits, authentic observations, evidence gathering. Ang findings ay varied pero theme ay consistent. Systemic underfunding, mismanagement, corruption, suffering patients. Ang reports from each hospital ay compiled, presented, actionable. Ang advocacy niya ay nag-evolve to national campaign, Health for All movement. Ang platform ay universal healthcare that actually works, not just on paper, kundi on ground, accessible, affordable, quality. Nagpartner siya with civil society, medical associations, patient groups, academic institutions. Ang coalition ay broad, powerful, unified sa vision. Alam mo, habang sinusulat ko ang kwentong ito, nag-realize ako kung gaano kaimportante ang health at ang access to quality healthcare. Kaya nagsulat ako ng isang special ebook na tinatawag kong Ang Mga Panalangin ng Isang Kampiyon. Naglalaman ito ng mga panalangin specifically designed para sa health at healing. Prayers para sa mga pasyente na nag-struggle sa sakit. Prayers para sa healthcare workers na nag-sacrifice daily. Prayers para sa policymakers na gumawa ng decisions affecting health system. Prayers para sa healing ng buong healthcare system. Prayers para sa provision ng resources. Prayers para sa wisdom sa treatment. Prayers para sa comfort sa suffering. Bawat panalangin ay rooted sa biblical truth na ang Diyos ay healer, na ang health ay gift, na ang life ay sacred. Kung nag-struggle ka with health issues, kung may loved one ka sa hospital, kung frustrated ka sa healthcare system, kung gusto mong mag-pray effectively for health concerns, ang ebook na ito ay para sa iyo. Ang link ay nasa description ng video at sa first comment na nakapin. Ang price ay minimal. Pero ang value sa spiritual at emotional support during health crisis ay priceless. Kunin mo na, basahin, pray the prayers at trust na ang Diyos ay gumagawa through medicine, doctors at prayers combined. Balik tayo sa kwento. Ang legislative efforts ni Manny ay nag-progress. Ang Universal Healthcare Act ay strengthened, additional funding secured, implementation mechanisms improved, ang oversight ay enhanced, transparent, accountable. Ang DOH itself ay nag-undergo restructuring, new leadership, fresh mandate. Ang culture ay shifted from bureaucratic to service-oriented. Ang priorities ay clarified, patient welfare first, always. Ang cascade effects ay nationwide. Ang local government units ay nag-invest more sa health facilities, inspired, challenged. Ang competition ay healthy, who can provide better services. Ang beneficiaries ay citizens, patients. Ang private sector ay engaged din. Corporate social responsibility programs focused on health, donations, partnerships, cause-oriented marketing. Ang resources mobilized ay significant, supplementary sa government efforts. Ang medical education ay adjusted, curriculum reforms, more emphasis on public health, community medicine, social accountability. Ang doctors produced ay not just technically competent, kundi socially conscious, servant leaders. Years later, ang transformation ay evident. Ang PGH na dating symbol ng failed system ay naging showcase ng reform system, modern facilities, adequate staffing, quality care, affordable, accessible. Ang pride ay restored, deserved. Ang patients na dati nagsuffer ay ngayong treated with dignity, respect. Ang wait times ay reasonable, ang services ay comprehensive. Ang costs ay manageable. Ang satisfaction surveys ay positive, consistently. Ang staff na dati overworked, underpaid ay ngayong compensated fairly, supported adequately, recognized publicly. Ang morale ay high, retention rates improved, brain drain reversed partially. Si Manny ay recognized internationally. Awards, speaking invitations, case studies. Ang approach niya na hands-on, evidence-based, patient-centered ay model, replicable, inspiring. Pero ang most meaningful recognition ay from ordinary citizens. Ang patients na na-serve, families na na-help, lives na na-save through improved system. Ang gratitude nila ay not abstract, kundi tangible, literal, life-changing. May reunion event, organized ng Patient Advocacy Group. Thank you, Senator Manny. Venue ay PGH mismo. Symbolic. Hundreds attended. Patients, families, healthcare workers, advocates. Ang program ay simple pero moving. Testimonials. Nag-share ang patients ng before and after experiences, dramatic contrasts, powerful narratives. May stroke patient na dati, 2 araw nag-antay ng ICU bed. Namatay unfortunately bago na-admit. Pero ang kapatid niya ay nag-attend, nag-thank dahil ang reforms ay prevented same tragedy from happening sa iba. Ang sister's death ay hindi in vain, naging catalyst through Manny's exposure. May pneumonia patient na bata, ngayong healthy na, nag-attend with nanay, nag-perform ng song, dedicated kay Senator Manny. Ang innocence, ang gratitude, ang hope, naka-encapsulate sa performance. May industrial accident patient. Ngayong recovered, working na ulit, nag-share na without reforms. Probably disabled permanently siya. Pero dahil sa improved OR availability at surgical care, complete recovery. Back to normal life. Nag-speak din ang healthcare workers, nurses, doctors, admin staff. Unanimous ang message. Ang reforms ay transformed not just patient experience, kundi work experience din nila. Mas fulfilling, mas sustainable, mas meaningful. Ang hospital director ay nagpe-present ng data, metrics. Before and after, bed capacity increased by 40%, wait time reduced by 60%, patient satisfaction up by 75%. Medicine availability 95% from 40%. Ang numbers ay speaking volumes, objective validation ng subjective experiences. Si Manny ay invited to speak. Ang speech niya ay short, humble. Hindi ako hero, ginawa ko lang ang trabaho ko. Ang real heroes ay kayo. Ang patients na lumaban sa sakit, ang healthcare workers na dedicated sa service, ang advocates na hindi tumigil sa pag-push for reforms, ang credit ay sa inyo. Ako ay instrument lang. Salamat sa trust, salamat sa support. Patuloy nating pahalagahan ang kalusugan. Ito ay karapatan, hindi pribilehiyo. Ang message ay resonated, ang values ay clear, service, humility, solidarity, ang leadership style na preferred niya. Not top-down, kundi collaborative, empowering. Ngayon, reflect, ano ang broken system sa buhay mo, community mo, bansa mo? Ano ang ginagawa mo about it? Nag-complain lang ba? Or nag-act? Nag-validate personally? Nag-push for solutions? Ang lesson ni Manny ay hindi kailangan mong maging senador para gumawa ng impact. Ang kailangan ay observation, compassion, courage, action. Bawat isa ay may capacity mag-expose ng mali, mag-advocate ng tama, mag-contribute sa pagbabago. At ang specific lesson ng disguise approach, ang authenticity matters. Ang filtered information ay misleading. Ang first-hand experience ay irreplaceable. If gusto mo ng truth, huwag umaasa sa reports lang. Makita mo, experience mo, validate mo personally. Salamat sa panonood. Kung inspired ka, share, lalo na sa policymakers, sa advocates, sa concerned citizens. Ang kwento ay call to action, hindi just entertainment. Comments, ano ang broken system na na-experience mo? Healthcare, education, justice, share. Let's document, collectively voice out, push for reforms together. Subscribe at like. More stories ng courage, reform, transformation, purpose ay consistent, inspire action, not just awareness, kundi actual movement toward better systems, better society. Tandaan, ang systems ay hindi nagbabago sa sarili. Kailangan ng agents of change. Ikaw, ako, lahat. Whether politician ka or ordinary citizen, may role ka, may capacity ka, gamitin mo. For common good, for vulnerable, for future generations. Start today. Small steps. Eventually, systemic transformation. Guaranteed. Ang istoryang ito ay nilikha ng AI, binuo ng independent at eksklusibo upang mag-entertain at magbigay ng values. Ang mga figure, entidad, senaryo, katotohanan at sitwasyong ipinakita ay katang-isip lamang at bahagi ng creativity ng mga mayakda.